Hello, my name is Krystle Craddock. I am a registered respiratory therapist here at UC Davis Health in Sacramento, and today I'm going to be talking to you about how to use your meter dose inhaler. The components to the meter dose inhaler include the mouthpiece cover, the inhaler and mouthpiece itself, the canister, and many inhalers include a counter on the back. Now let's talk about priming your inhaler. The manufacturer of the inhaler includes extra puffs for you to prime your inhaler before you use it the first time. And if you haven't used it in over a week, you should prime your inhaler. What you're going to do is you're going to shake your inhaler up really well, remove the mouthpiece cover, and you're going to puff once into the air and just let the mist go out into the environment. You're going to repeat this step 3 times. Now let's go over the steps of using your meter dose inhaler. It is always recommended that you use a spacer or holding chamber with your inhaler. So what you're going to do is you're going to attach the mouthpiece of your inhaler onto the back end of your spacer, like so, and then remove the mouthpiece cover of your spacer. You're going to shake the inhaler up really well. You're going to exhale all the air out of your lungs, not so much to make you cough. Then you're going to hold the mouthpiece up. Make sure your head is neutral, your chin is up a little bit. You're going to exhale the mouthpiece in your mouth, puff the inhaler, and take a slow, deep breath in. You're then going to hold your breath for 8 to 10 seconds. If you breathe too fast, your spacer will make a honking noise like this. It's kind of a feedback mechanism to tell you to slow your breathing down next time. Once you've done the breath, you've done your breath hold for 10 seconds, you're going to exhale, you're going to catch your breath. If you do more than 1 puff, or if you're prescribed to take more than 1 puff, you're going to take about 30 to 60 seconds in between each puff, and then you'll do the steps all over again. If your meter dose inhaler includes a corticosteroid, it's really important to rinse your mouth out after each use with water. Now we're going to talk about cleaning your inhaler. What you're going to do is remove your inhaler from the spacer. You're also going to remove the canister from the main inhaler piece. You're going to make sure that you run this under just warm or lukewarm water for 60 seconds at least. The goal is to make sure nothing is occluding where the medication comes out of in this mouthpiece. You're going to rinse it off really well. You're going to check and make sure there's no debris or anything in there. You're going to then shake it off and lay it on a paper towel to air dry. Make sure not to use any tissues or paper towels to wipe it off. Air drying is the best. Thank you for taking the time to learn about your meter dose inhaler. If you have any questions about your inhaler or your medications, please reach out to your healthcare provider.